in a short amount of time, and it's going to make a big difference for Iowans. So again, thank you for your time and effort in making our rapid statewide implementation possible. So with that, we will open it up for questions.
Governor, have any of the test Iowa machines in the state hygienic lab that have been validated and approved for use, are they being used to process tests? And where's the money coming from to hire the people at the test Iowa sites to actually do the testing?
Yeah, so we have been able to run some of the Test Iowa tests through the State Hygienic Lab using some of the Test Iowa equipment and the State Hygienic Lab equipment. We're still working to validate the PCR process, so they're still working on that. They've made tremendous progress over the weekend, but we also had to allocate a lot of the time to process the backlog, so they've been able to address both, and that's what I mean. It's been just a heroic effort by everyone at the facility. So as I've said before, the Guard is the ones that is instrumental in helping us set up the Test Iowa sites, as well as Homeland Security, the Department of Transportation. We have used nurses from the Department of Human Services, and then we're contracting with some nurses that have been furloughed to use at some of the Test Iowa sites. So that's a partnership that we have with a couple of our hospitals, which has been great. And then of course we did a press conference on iServe, so there's nurses out there that just simply want to volunteer. So they've also been a part of the Test Iowa setup. And so remember, we've got CARES money coming into the state to help really pay for some of the testing capacity that we've done so we can run it through FEMA, which is a 75-25, and that encumbers everything that we're doing for the increased testing ability. That's LabCorp, that's the national labs, that's what we're doing at the State Hygienic Lab, and then Test Iowa. So some funding we can process some of the funding through that, 75-25. We're hoping to get it 100% funded, and then in addition to that, there's also just some specific funding through the CARES Act for testing, because they're really wanting states to ramp that up.
Governor, referencing the backlog, we've spoken to a couple of Iowans who were tested on April 25 that still haven't gotten the results back.
Yeah.
At the Test Iowa site, how big is this backlog, and what percentage of the total Test Iowa?
Yeah, so we got about 900 to 1,000 through yesterday from the Test Iowa, and we should complete the backlog today. So then we'll be back on track. You saw the numbers from the weekend. They were really able to process a lot of the test and to get us caught up. And so then we should be in a pretty good place moving forward as we just start to continue to build out the Test Iowa sites. Again, I talked about, using other labs as well with LabCorp, and then another component of this is the serology testing that we're doing too. We're one of the few states that are doing that as part of our surveillance testing with our long-term care facilities and some of our manufacturing facilities, and that really does help, again, just address some of the individuals that were asymptomatic, didn't even know that they had it, but actually have and have recovered. And so that's a part of that helps us really identify the scope of the virus activity in each one of the facilities and really take the steps that we need to separate those that have tested positive and negative or were asymptomatic and tested positive through the serology testing.
Governor, we get a lot of questions, as you might guess, about Test Iowa. How can the public know when these daily reports come out what came through a Test Iowa side, what came through others,
Yeah.
and then also who had shown symptoms, who had not?
Yeah, so
Kind of the broader picture.
yeah, and I might let Sarah talk about this, but from the very beginning, we didn't separate out the different testing opportunities. I mean, we've been using first it was the national labs, and then we've had hospitals and that have come on board, and they're able now, once they were validated, to actually do the test and then process it right at their facility. And so Test Iowa would be no different. So we really never have broken those out. We've reported total tested positive, and total tested negative, and I really don't anticipate changing that process. Do you have anything to add to that, Sarah?
The only thing that I would add is, we have health systems doing testing, we have national labs doing testing, just to the governor's point. And I can tell you, I've spoken personally with Dr. Pentella. He's not going to run equipment if he doesn't have confidence in the equipment and its performance. And so there'd be no reason to separate out Test Iowa results separate from any other test results, because the Test Iowa equipment is going through the exact same kind of validation that all of the other tests that are happening have done. And so we'll just continue to report positive test results regardless of the source as one positive number.
How will the public know whether Test Iowa is as accurate as everything else?
Well, we do that through the validation process. And so just like they validated the state hygienic lab through the CDC process, then we'll use that same process to validate Test Iowa. And I have complete confidence in Dr. Pintella and the state hygienic lab to complete the process. They're not gonna validate it until they're, as Sarah said, until they're comfortable that it meets the criteria that it needs to meet.
When you take a strep throat test, there's a high negative, and often they run it again through a different kind of test and call you later and say, actually, you do have strep throat.
Mhm.
Are you, the negatives, are you in any way reaching out to them and encouraging them to run it separately if, as suspected, some of these Abbott machines have a 15% false negative?
Well, Sarah, yeah, that might be just outside of my scope of expertise.
Okay, what I would say about that is if somebody's had a negative test, if they are still feeling ill, if they need to go to their doctor, they should continue to seek health care. If they continue to worsen, if they continue to be symptomatic, if you are sick and you have had a negative test, that doesn't mean that you should not seek health care. You should call your doctor's office, see if you need to be reevaluated, and every Iowan should do that all of the time if they're not feeling well.
So you spoke to, along those lines, sorry, Senator, you spoke to the family of a man who tried multiple times to get health care, tried to get tests. Eventually he was able to get a positive test for COVID, but he sadly passed away as a result. What does that say about kind of the structure that the state has set up for providing tests and the healthcare system for providing care to individuals?
Well, first of all, any death is heartbreaking, and I can't imagine the grief that the wife is going through. So, anybody that has lost their life to COVID-19 is just horrible. But as we've said all along, if you have symptoms in your home, call your doctor. They will run through with you an assessment and make the determination, the physician, the clinic, whether you should be tested or not. But like any other time that you visit the doctor, if you're not satisfied with what they tell you, if you're still feeling sick or ill, I would encourage Iowans to get a second opinion. If you believe that you have been exposed or that you are demonstrating symptoms and you go to a clinic and they don't test you, then I would encourage Iowans to get a second opinion and to continue. These are Test Iowa is a tool. It's on top of all of the other testing options that Sarah was talking about. But again, just reiterate over and over: if you're feeling sick or you're exhibiting some of the symptoms or you think that you've been exposed, then call your doctor, walk through them what you're experiencing, and then they will make the decision on what you should do.
Aaron Murphy, Lee News.
Thank you, Governor. You said this morning on a conference call with other governors talking about reopening strategies that the next phase in your strategy for the state is growth. I was just hoping for some clarification on what you meant by that. Are you talking about economic growth,
Yeah.
or are you actively considering lifting restrictions in more counties or lifting more restrictions?
No. So, I talked on the call how we kind of had three phases. Stabilization was really about mitigation, and it was about resources. And so that's why, you remember, I talked about putting the RMCC into place. We wanted to, first of all, make sure that we were protecting our most vulnerable Iowans, that we were managing our resources so that we could start to flatten the curve and not overwhelm our hospital system. And today, we have over 4,000 beds available. We have over 550 ICU beds and over 650 vents. So we've been able, with the good work of Iowans, by really being responsible and doing what they've needed to do, we've been able to demonstrate, not only statewide but by region, that we have the capacity to treat COVID-19 and in fact have, pretty good excess of beds and vents and ICU beds across the state, which is good. And unprecedented unprecedented collaboration from our hospitals all across the state. I appreciate the efforts that they put into this for daily reporting so that we can have some sense of usage and discharge and where we're at as we move forward. So I appreciate that, and because of that, then we really moved from mitigation efforts into easing some of those mitigation restrictions, and we moved more into a containment and management of virus activity, and so that's where we're at right now. So that's where we started to ease some of the mitigation efforts that we put in place for Iowa's 77 counties. We still have some pretty significant protocols put in place as we start to open up restaurants and fitness centers and some of our retail outlets and elective procedures, opening up them. There's still a lot of parameters that they have to abide by in order to do that. And so we'll watch that, and we're hoping as we can use the test, the assessment, the testing, and the case investigation, we'll start to continue to watch counties and see if there's maybe additional counties that we can bring on, or maybe there's additional things that we can start to open up. But we'll do that on a daily, weekly. I think the declaration or the proclamation that I have in place right now goes through May 15th, so we're going to continue to evaluate and see what's next. In the meantime, later this week, I'll be talking about the governor's economic recovery task force, and that's really bringing individuals together to really understand the impact that COVID-19 has had on Iowans, our families, our businesses, and our state economy, looking at how we react to that, to come back even better and stronger, and maybe redefine some of the ways in which we are serving Iowans through what we've learned through this pandemic, and just apply some of those strategies to really, moving from stabilization to recovery now into growth. And so we're going to put a great team together that's going to really analyze that, put some metrics in place, and talk about how we start to, after we get through the growth phase, start to open up and grow Iowa's economy.
Chris, KCCI.
Hi there. So the Tyson plant in Perry, Tyson still refuses to release numbers of infections there, and numerous local officials there in the city of Perry have called for Tyson to do so, and the Dallas County Health Department won't release the numbers either. Do you believe it's in the public interest for the public to know those numbers? Is DPH willing to release those?
You want to talk about that? We're actually meeting this afternoon to discuss that.
Hi, Chris. Thank you. Yeah, the Department of Public Health, working with our state medical director, there's a state statute that talks about her ability to release information related to names of businesses when it's in the interest of the public's health. And so we've been having those conversations in terms of what is that threshold for identifying an outbreak at a particular business. And that's actually one of the things that we'll be confirming today in terms of where we have seen outbreaks and whether it's in the public's interest for us to release the names of those businesses at this time. So I think it's actively on the to-do list for today, and we'll have more information for you in the next couple of days.
And as a follow-up to that, what's the criteria for saying if something is of public interest if a business is not?
Well, okay.
Yeah, so for businesses, it's for 10% of their workforce has been identified to be either COVID positive or has been in close contact with somebody who has identified to be positive for COVID.
This is hard and fast.
The 10% threshold.
Yeah, are those thresholds?
Yeah, that's been the legal threshold that we've determined working with Dr. Padati to identify those businesses. And so we'll be taking a look at our information and be prepared to make that public in the next couple of days.
Nicole.
And we have made it clear where we're doing the testing. So we've talked about the different facilities all the way through that we were actually doing some of the surveillance testing. And so we've been pretty transparent about that. And as Sarah indicated, we'll be addressing the other in the next day or two.
We've got time for 2 more questions. Nicole, KCRG.
Governor, what will the threshold be to increase restrictions on the 77 open counties? For example, 5 days ago, Wapello County, southeast Iowa, had 15 cases. Today they reported 84 cases, and they announced the first death related to the virus over the weekend, and only 8 people there have recovered. Does that rapidly growing case count concern you?
Well, we're going to continue to watch it on a daily basis, and with the testing capacity that we have, with the assessment, and then with the case investigation and the contact tracing, it really does allow us to look at some of the spike in cases, not only from a state, but county to a community to even down to a zip code, so that we can start to monitor that and address it in a fairly rapid way so that we can hopefully prevent seeing a significant spike. So we're going to continue to monitor the counties across the state. Remember, as I said earlier, they still have pretty significant controls in place for businesses that are starting to open up. And what I've seen, even from businesses and restaurants and churches, they really are being very judicious and thoughtful in starting to open back up some of their businesses and churches. They just they're putting protocols in place. They want to make sure that they are giving the consumers confidence to come back into their facility. They want to make sure that they're not putting their congregation in any danger. And so what I've seen as we've started to, loosen and ease some of the restrictions is a great deal of responsibility being taken by the businesses and the entities that we've started to open up just a little bit. And I appreciate that very much. So we're going to continue to identify clusters or areas of concern. We'll do the case investigation, and that'll allow us to really figure out who's been in contact, what is the exposure rate, can we contain it, or are there additional steps that we may need to take?
Last question, David Pitt, Associated Press.
Oh, yes, Governor, thank you for taking our questions. So on the call this morning with the other governors, where you applauded for being among those who are taking these steps to open, I think you had to leave before the question was asked, but the other governors answered the question. I'd be interested in your response, and that is, it's a difficult track to take to open up again and balance the political pressures that you're getting to reopen the state with the data that you're reviewing and the real life implications of reopening. So how do you balance that, the politics of all of this and the pressure from the business community perhaps and from the business community to reopen with the realities on the ground?
Well, first of all, I did answer that question before I stepped off, and I kind of had a hard stop and went 15 minutes longer than I had said I would be able to do. But this isn't political. That's one of the reasons I've been able to stand here every day and talk to Iowans about making decisions based on data and metrics, based on the expertise that I have working for the citizens of Iowa, whether that's the Department of Public Health, their incredible EPI team that's in place that are working day in and day out to really provide great information and recommendations to me in collaboration with the CDC. We've aligned very well with much of what they've asked and required and encouraged states to do across this country. They've worked with their colleagues across the state, just like I've worked with my colleagues across the state, to understand some of the steps that they've put in place, some of the mitigation steps, how they're talking about opening things back up. These are some of the hardest decisions that I've had to make as a governor of this great state. We had a growing economy. Our cash reserves are full. Our fiscal health was strong. Iowans were doing well. Our unemployment rate was low. And to have this pandemic hit the state and our country and have it impact Iowans and businesses and families in the manner that it has is heart-wrenching. To talk about the amount of deaths and the people that have lost their lives due to COVID-19 and how we manage all of that. And you just can't look at it from one isolated perspective. You have to look at the health and the well-being and the mental well-being and the livelihood of Iowans. As I said the other day, we're seeing increase in substance abuse. We're seeing additional food insecurity. We've had over 200,000 Iowans who are receiving unemployment claims. We Iowans are meant to work, and we need to open back up, but we have to do it in a safe and responsible manner. So this isn't political, and it shouldn't be for anybody, and I don't believe it is. It's about trying to do the right thing in an unprecedented time to really manage the health and well-being of Iowans and their livelihood, and we're going to continue to make decisions based on great recommendations from a group of experts that I feel very confident in the information that they're providing me. So thank you.